Welcome back. It's time now to answer some pretty common medical questions, particularly this time of year. So joining us is News Channel 5's medical specialist, Dr. David Soria. When he's not hanging out here with us, he is the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks for stopping by on Thanksgiving Eve.
You betcha. Good to see you.
Good to see you. Some flu questions for you. Pretty timely this season. What's the best way to relieve cold and flu symptoms?
You know, that's always a good one because we see so many, especially this time of year. And one thing I know that most people realize, and that is that there really is no cure for the common cold, but yet millions of us go to our doctors every year asking for those antibiotics. So
we're on a quest for it, aren't we?
You betcha. So one quick take home: they don't work. Don't bother taking them for a couple of reasons. One is that they're expensive. Second is they do have side effects. And the third is we're seeing more and more resistance to them. So try to avoid them unless your doctor says they absolutely are going to benefit. So what does work? Well, simple measures. Plenty of fluids, keep your body hydrated. That's what helps your immune system fight the infection. Salt water gargles for your sore throat. Good old-fashioned
salt water.
You betcha. Zinc, recent studies showed that it is beneficial. And my favorite, what actually works best for me and many of my patients, is cough and cold preparations. Takes away the cough, allows you to sleep at night, allows your immune system to fight the infection. What doesn't work? Antibiotics. And if your child is less than 2, don't bother with the cough and cold preparations. They don't work.
Got it. All right, good advice there. We heard a lot about H1N1, particularly all over the news, it seemed, last year. Not so much this year. Is this still a concern?
You know, it is a concern, but just to kind of give you an idea as to how concerned we Americans were, 40 million doses of the H1N1 vaccine were discarded last year because they expired, costing about $250 million.
Wow.
And this year, another 30 million will be discarded. So, obviously, not used.
Is that because people just weren't concerned, or we ordered too much, or how does that happen?
We meaning the CDC and the government, ordered what we thought was necessary to vaccinate the community.
Wow.
The Americans weren't concerned enough to receive the vaccination. So did we blow it out of proportion? Well, not necessarily, because lessons learned in years previous, especially the Spanish flu of 1918, was that the second strain that mutated was much more dangerous and much more deadly. So we don't know what years will bring, or what next year, the year after, will bring when it comes to H1N1. So it's always good to have our guards up.
Sure.
One thing's for sure, the CDC does recommend it for all right, but for sure, for those 6 months to 5 years, who are pregnant, healthcare workers, and people who have a bunch of other illnesses.
All right.
Okay?
All right. Thank you so much. If you have a question for Dr. Soria, you can always get it to him through our website, WPTV.com. Just click the health link. Thanks so much for coming in. Happy Thanksgiving.
Happy Thanksgiving.
We are following breaking news this midday. A West Palm Beach police officer has been involved in a motorcycle accident near Congress Avenue and Embassy Drive. Don DeLucia with Fire Rescue says the officer is down and CPR is in progress. We do have a crew on the way. We are continuing to gather more information and will bring you the very latest as it becomes available.